As we get older, there are 5 daily exercises that can really help with common problems like muscle loss, hip and knee discomfort, a bent forward posture, and falls. The first one is especially important. It is one of the best moves for balance and fall prevention, and it can also ease hip and knee pain by building strength in the outer glutes, legs, and feet. If you choose only one exercise, make it this one. Stand in front of a kitchen sink, counter, or rail and alternate balancing on one leg. Make sure you shift your full body weight onto the leg you are standing on and gradually work toward holding each side for 20 to 30 seconds every day. If that feels too difficult, begin with both feet on the floor, placing one foot slightly in front of the other. If it feels too easy, gently move your body weight around a little to make it more challenging. The next exercise helps improve circulation in the legs, strengthens the calves for walking on slopes or stairs, and helps you lift your toes better when walking so you are less likely to trip. Stand in front of a rail or kitchen sink again, rise up high onto both heels, then lower back down slowly over 4 seconds. After that, lift both toes upward. Be sure to hold the rail when lifting your toes so you do not fall backward. Repeat until you feel a light level of fatigue, and do this every second day. If it feels hard, you can press a little through your arms to help raise yourself. If it feels easy, try doing some or all of the repetitions on one leg and then the other. Many people become more stooped with age, and this not only makes the body feel older and tighter, it can also lead to shoulder problems. It shifts the center of gravity forward as well, which can make tripping more likely. So the next movement works on that. Sit down with your hands resting on your knees. Lean your torso slightly forward, lift your chest, and draw your shoulders back so your mid-back becomes flatter. Then gently tuck your chin and pull your head straight backward. Hold that position for a few seconds, then let your head come forward again. Repeat that 10 to 15 times once a day. The next one builds very important muscles for mobility and makes it much easier to get up from a chair and sit back down again. It also helps reduce lower body muscle loss, often called sarcopenia, which becomes a major issue with aging. Sit near the front edge of a firm chair with your feet and knees about shoulder width apart. Lean your torso forward, stand up, and press your pelvis forward fully so you come all the way upright. This helps activate the glutes well. Then sit back down again slowly over 4 seconds. Keep going until you feel light fatigue, and do it every second day. If it feels too hard, use your hands on your knees or on the armrests to assist. You can also place a few folded towels on the seat to make the chair slightly higher. If it feels too easy, lower yourself toward the seat without fully sitting, then rise back up again. So far, most of the work has been for the lower body, so now it is time to include the upper body and core. This next exercise is excellent for shoulder health, posture, and reducing muscle loss in the upper body, especially if you keep your chin tucked in properly. Stand on a non-slip surface about an arm's length away from a wall. Place your hands slightly wider than shoulder width and around shoulder height, with your fingers turned slightly inward at the top. Keeping your whole body straight and your chin gently tucked, lower yourself toward the wall slowly over 4 seconds. Breathe out as you go. Try not to round your shoulders, and keep your stomach muscles engaged so your hips do not sag toward the wall. Then push yourself back to the starting position and repeat until you feel light fatigue. Do that every second day. If it feels difficult, move a little closer to the wall. If it feels easy, step farther away or do the same movement against a kitchen bench or rail. To finish, place your hands on your head, draw your elbows back and down, and squeeze your shoulder blades together 10 times. This helps activate the muscles that move in the opposite direction, so the upper body stays more balanced. That is it. These exercises can make a real difference in balance, posture, walking, strength, and day-to-day movement after 60. If you stay consistent with them, they can help protect your body from many of the issues that become more common with age. Senior health tips.